This is Mark Brandreth, the Chief Exec of the Robert Jones and Agnes Hunt Orthopaedic Hospital in Oswestry, and you're listening to the HSJ Health Check podcast.
Hello and welcome to this week's HSJ Health Check podcast. I'm Dave West, HSJ's Deputy Editor, and each week we're gathering a cast from our team of expert journalists to explain and debate the most important news issues right now in NHS policy and leadership. HSJ Health Check brings you a uniquely up-to-the-minute, robust and informed analysis. We're available each Friday morning on the hsj.co.uk website and across all the other main podcast channels. This week, I'm joined by one of our core podcast team, Annabelle Collins, who is also our workforce correspondent, and also by HSJ editor Alastair McLellan and Bureau Chief for Finance and Policy, Lawrence Dunhill. And in each of our episodes, we'll tackle 2 or 3 big questions from the week's news. And today, in our 30 minutes, we're going to look firstly at what we learned from Labour's big NHS policy announcements this week, and secondly, what should we read into the announcement yesterday that the boss of Greater Manchester's Devo health experiment is quitting. So first of all, Alastair and Lawrence, you went yesterday being Wednesday, to the announcement by Labour of their big NHS spending announcement ahead of the general election. Speeches made by John McDonnell and John Ashworth at the Royal Society of Medicine. And first of all, we want to ask you both a few things about what you learned there. So first of all, Alastair, what were you hoping to find out yesterday, and what did you find out?
What I was hoping to find out, more than anything, was what the mood music would be around Labour's NHS messaging. Obviously, they were going to promise more money because, as John Ashworth said at the do, that's what Labour governments do. They spend more money on the NHS, and history proves that to be true. But I was really looking to see how they might approach the, say, broader reform issues of the NHS. This week we sadly saw the death of Frank Dobson, the Labour Health Secretary between 1997 and 2000. And Frank was a politician from a different age. He used to catch the bus from his council flat opposite the British Library every morning when he was Secretary of State for Health, and he was famous for distracting journalists who asked him difficult questions with very rude jokes. Simon Stevens tells a lovely story about him in which they were debating whether they should close Barts. At the time, it seemed like very much the right thing to do. And Frank Dobson said to Simon that he was not going to be the health secretary responsible for closing the hospital that had treated the wounded of Agincourt. So I think Frank was the kind of... He always described himself as a member of the sane left. And I think what we saw yesterday at the Royal Society of Medicine, where the Labour had their launch, was Jonathan Ashworth and particularly John McDonnell, very much portraying themselves as members of the sane left. Lawrence asked a question about their support for their view of Simon Stevens. We asked that question very deliberately because John McDonnell and John Ashworth have been at meeting after meeting over the past 3 or 4 years with groups like Keep Our NHS Public, etc., in which they have been told time and time again that Simon Stevens is a sort of a privatiser, an Americaniser of the NHS, and they should get rid of him. And they had a real opportunity there when we asked them the question to say, yes, we agree, we think we should get rid of him. But that was very much not the answer. And that pragmatic approach shone through a lot of what they did. We'll talk about the level of money in a moment, and there was a significant level of pragmatism in that. Lawrence interviewed John Ashworth after the speech, in which he talked about the use of the private sector, because if Labour are going to spend more money, which they are, and they're going to drive down waiting lists, then in the initial years, of course, there won't be the extra NHS capacity to do that, so they'll actually have to use the private sector. So at least in that area of elective care, we could see the use of the private sector increase in the first year of a Labour government. But Lawrence asked them about that, and he gave a very sort of pragmatic answer. So I think that was very interesting. The mood music around that was very interesting. But what really matters, of course, is money. And Lawrence, why don't you give us our views on that?
First of all, can I just ask you, Alastair, do you believe them on the pragmatism thing? Should we believe them that they will take a pragmatic approach?
Well, I think that very much largely depends on parliamentary arithmetic. If they were in a position of as a minority government, or yes, if they were a minority government, they won't. That's the only situation they will be in. They won't be in any kind of alliance. So if they're in a minority government, I think you would see them treading carefully, because they wouldn't want to make lives more difficult for themselves. I'm reminded of the 1997 election, of which, of course, this is very different from. But I don't know if people remember, before the 1997 election, Tony Blair had promised Paddy Ashdown that when Labour had won, one of the first things they would do is announce a Lib-Lab pact, basically locking in sort of centre-left parties into government sort of forever for the Britain. When Labour won by such an enormous landslide, people like Prescott and Gordon Brown said, no way are we sharing power with the Lib Dems now. We're going to do everything our way. So I think it really depends on the size of any majority that Labour got. The bigger the majority, the more true to their sort of Clement Attlee, Nye Bevan roots they will be.
And what do you think on a second question about on the Simon Stevens relationship issue, which as you say is an important kind of signal? They've sort of given him their nod. But do you sort of feel it would be potentially an enduring relationship between a Corbyn government and a Simon Stevens NHS?
Well, those who read HSJ will know that we wrote an editorial in a few months ago, suggesting that Simon will be with us for about another 12 months or so, a bit less than, that he would be gone or going by next summer. Now, that sort of makes it easier for Labour, because they know, they believe that he won't be around for that much longer. If for whatever reasons that scenario didn't occur, well, that would be interesting. I'm pretty sure while Jonathan Ashworth was Health Secretary, things would rub along fine. If he was replaced by a more radical figure, Rebecca Long-Bailey, for example, then we might see some tension.
Yeah, I think that Simon certainly sort of left the door open to stay, and NHS policy, the NHS long-term plan is perfectly aligned to fit with both parties, really. But he's clearly sort of also put down a marker that they could give him a way out if he wants it.
Yes, I mean, the Labour Party manifesto will be out next week or so. It'll be very interesting to see what they say about STPs, ICSs. Are they opposed to them in principle, or do they just want some kind of law which says they can't be run by private sector organisations, which the Conservatives said anyway, but maybe they'll want some kind of legislation. So that would be definitely one to watch.
Okay, and so Lawrence, the crucial issue is the money. And was this the sort of numbers you were expecting? Do you think it's game-changing spending increases that Labour's promising?
So it's sort of game-changing, but not hugely. The probably the most important figure is an increase of 3.9% per year in real terms to the NHS England budget. And that is a direct comparison to the 3.4% per year given in Theresa May's funding settlement last year. I think it's also important, and they should be given credit for this, that they've set out what they would do to the overall Department of Health and Social Care budget as well, which includes capital, training, public health, and so on. That overall budget is going to rise by 4.3% per year in real terms. We can't compare that to the Conservatives yet because they haven't set that overall budget out. And within that, they're going to increase capital by 15 billion spread over 5 years. And that's more than the government have said previously. That compares to their 10 billion, which they pledged after the Naylor review.
I think that's what's interesting about the Labour spending pledges is it is significantly more money, but it could have been much, much more. I mean, I want to come back to this point about being, the sane left. Jonathan Ashworth referred to John McDonnell during that presentation as a bit of an iron chancellor. It must have been really, really tempting to really splurge the cash on the NHS, to put Blair and Brown in the shade, for example, which they very much haven't done. Personally, I think that's a good thing. I'm hoping that they're keeping a lot of money back for other areas, particularly social care. We're promised them their social care policy soon. But that the level of investment they have given is going to, and also what they've said they're going to want to do with it. They've very much focused it on restoring waiting times. And, in some ways, it's a very traditional approach to NHS politics. When Jonathan Ashworth was challenged on the fact that this money was basically going to go to increasing capacity so that elective waiting times could come down and A&E performance could improve, he said, well, I'm often accused of not wanting, of being anti-transformation or anti-reform. As far as I'm concerned, reducing the waiting list from 4.5 million, getting rid of long trolley waits in which elderly people are waiting, lying in corridors, that is transformative to me. Now, that's a very interesting thing for him to say, because basically what he's saying there is, all this stuff about STPs and ICSs. Well, I'm not saying it's a bad idea, but it's not the game in town.
Whether you can actually make those, because the argument around integration has been that actually you can't make those sort of changes that were made in the 2000s in that traditional fashion anymore. You have to have a modern functional health and care system. You have to integrate it and provide services that aren't focused around hospitals. And this reform is the only way. But there may be an argument. Growing sort of pace and steam that actually there is another way, and it's exactly how we did it in the 2000s. So.
Well, I think I don't want to put words in Jonathan's mouth, but I think he would say the difference for us is that we're going to take public health seriously. In other words, we're going to really focus on the determinants.
To be fair, didn't they? They did.
Well, and of course, the level of money that they've given to public health is significantly more than under the Tories, but it's still, as I said in today's Daily Insight, it's still very much in the repairing the damage, keeping the lights on territory. It's not a massive increase. But just to stress the point one final time, the big influencers on determinants of health are not sort of public health ones. They're employment issues, housing issues, social care, etc., etc. And we shall see what Labour have to say on that.
And I wanted to actually ask you both what was said about staffing and workforce.
Well, Jonathan, it did come up a number of times. There wasn't anything, I think, specific that was that we didn't know. They did commit again to passing safe staffing legislation, which would clearly have an impact on
bringing England in line with Wales, for example, I think.
Exactly. And they did talk about paying people more, and that is one of the other things to think about in relation to the extra money that Labour are offering. Labour is offering extra money, but it's also making more promises on those money, particularly about people's wages. And obviously, if you pay people more, then you can employ less new people. Of course, increased payment may help improve in retention.
And the idea of the 4-day week as well. Is it fair to say there was this divide between Ashworth and McDonnell? A Times email popped into my inbox this morning saying the party's divided over this.
Yeah, well, I mean, that was knockabout stuff, quite honestly. Here we have the tension between the sane left and, I don't know what we might call it, the aspirational left. And it was the way that John McDonnell explained it, and he explained it 4 times as the national journalist went again and again at trying to see if there was any divergence between Ashworth and McDonnell, was that, this is an aspiration for 10 years' time in which they'll work towards, and there's actually, a sort of return to what Labour used to focus on, which was not necessarily how much people were paid, but how much people were expected to work for the pay they received. We shall see. To my mind, it's pretty much a complete red herring. And anyway, even if there were some divergence, it wouldn't be a divergence that wouldn't actually emerge in the next Parliament. It would be the Parliament after.
It appeared they resisted the potential to the NHS pensions issue that we talked about on the podcast last week and before. Is pensions tax for particularly for senior doctors is causing absolutely enormous problems, and seems like a huge open goal for Labour during a general election campaign to say we will fix this immediately.
The pensions issue is really interesting because I agree there is no more pressing issue facing the NHS right now. In other words, a thing you could do right now, which is to end the pensions taper so that doctors and particularly doctors, but also other high earners, are not faced by unexpected tax bills. These tax bills are huge, and the various methods that people are using to try and get people back to work are not working, as far as I'm here, because people are terrified of £100,000 tax bill
because
dropping through.
Because they need to make it simpler, they make it more complicated.
Exactly, and they just don't. They don't trust it anymore. But when John McDonnell talked about how this investment in the NHS would pay for, he said, we will tax those people who are the 5% of top owners. We will increase national income tax. I think this is right, that the top 5%, their salaries start at about 120k, which of course is exactly the type of level that many hospital consultants earn. So this is hospital consultants, many of them, the more senior ones, or just the run-of-mill hospitals. This is exactly the group of people that Labour want to tax. So the idea tax more. So the idea that they might offer them some kind of tax breaks runs against that. And the unions are certainly being very, very vociferous, saying you mustn't treat these rich doctors differently from us. You must sort something out for the whole workforce rather than signalling them out, which is perfectly fair, but it means they are basically cut off from dealing with the most pressing problem quickly.
I guess the medical unions are never going to do much, but come out in favour of Labour, if anything, on these sorts of times. Let's move on to our second issue for today, which is that I want to talk about the announcement from Greater Manchester that John Rouse, who's effectively been the boss of the devolved integrated health and care partnership in Greater Manchester since 2016, has announced he's leaving early in the new year to become effectively the boss of a local authority, Stoke City Council. And I've got some views about this. This is what it says for the wider integration, system working, sort of policy agenda. But first of all, Lawrence, in addition to finance for us, you cover the Northwest, including Greater Manchester, and followed the Devo Health project quite closely over the last few years. And part of the context, obviously, is that John was appointed in a sort of blaze of central government enthusiasm for the Devo project back in 2015-16, and which is now not there. But why else do you think he's decided to move on at this point?
Yeah, so a lot of it, I think, is that we're coming to the end of that 5-year sort of devolution deal. We're in the fourth of the 5 years now, and so they got this transformation fund in 2016-17 of 450 million, and that money's largely been allocated, and so there's simply less for John and his team to do. But I think another really important factor is the new management structure that's been introduced across England and in the Northwest, where you now have Bill McCarthy's regional team for NHSI and E overseeing effectively what's going on in Greater Manchester, whereas before John Rouse reported into Simon Stevens. He had they had a unique situation there. Greater Manchester is now effectively just treated like everywhere else is and has to report into that regional directorate. Apparently John and Bill get on well, but there's no doubt it's changed the dynamics, and various people in Greater Manchester tell me that it very much feels like it's marked the end of the devolution project.
I mean, why does it feel different? I mean, he always, presumably previously reported to Paul Baumann as Chief Finance Officer. I mean, I don't suppose, it's one rung down, but why does this really make a difference for someone in John's position?
I think because previously, if a trust was doing badly on something like the A&E target, they would be getting calls from John Rouse and wanting assurance as to what they were doing. But now that's happening with the regional team and Bill McCarthy, and so I think John's team have stepped back. So
they're getting regulated in the same way as everyone else, and he's no longer. When the appointment was first made, there was this idea that John and his team would be the boss of the NHS and social care in Greater Manchester, and that's perhaps was never quite the case, because if you're a sort of big beast of Mike Deegan, chief exec of Manchester University FT, you probably talk to people more senior, and perhaps sounds like that's become increasingly so over the years, perhaps.
Yeah, and there has always been that tension there. I think kind of people have listened to John Rouse and the Devo team to varying degrees. So some have ignored them and some have kind of got a bit more involved. I think it's also important that, just like commissioners around the country, the devolution team has had to take out 20% of their spending, so they've had to cut staff.
Yeah.
So Lawrence, the question I wanted to ask is what sort of state is the Devo Manc project in? Is it still going? Is there something which we can sort of point at and say something different is happening here? This is a healthcare economy working significantly differently to other healthcare economies, where there is a real collegiate cross-boundary working approach. or is it sort of fading back to a more still collaborative approach, but less the sort of the vision that was originally put forward sort of 5 years ago or something?
I think the real differentiator, and what John Rouse to some extent embodied with his local authority background, is the integration that's gone on with the councils in Greater Manchester, so that all the CCGs are much more integrated with their local council than in other areas of the country. I think half of them have a joint chief exec and accountable officer between the council.
But that's
understood.
But that is a model that's found elsewhere. I mean, what I suppose I'm saying is Manchester simply now just a sort of a more fulfilled example of things you might find otherwise in other places, or is it something distinctly different? Because a lot of people say that Manchester.
I don't know of more than one or two other areas that have that arrangement.
Yeah, they've. I think they've certainly blazed. I've covered the sort of integration developments for a few years, and they've certainly blazed the trail and done so at a greater kind of pace and much more visibly than most parts of the country on developing integrated models but not of a particularly consistent type. There's some CCGs sharing with local authority chiefs. There's some. There's a kind of Salford Hospital chain. There's FTs merging. There's work to develop kind of integrated care organisations, whether that be Salford that's taken on and other parts of GM as well, Tameside and things have developed pretty unusual models of employing social care staff and commissioning social care and things. So it's sort of been a real hotbed for innovation and change. I think what they've really found difficult, and have also pioneered, the kind of what is an integrated care system. Well, they've all became an integrated care system of having a coherent, regional, sub-regional kind of management and plan. They did pioneer that and sort of help show the way. What's been much more difficult, like for much of the NHS, is actually showing that it can help manage all the rapidly growing demands and inadequate workforce and inadequate premises, actually showing results from it. I don't know whether I think you've started to look at whether the actual results are there, Lawrence.
Yeah, it's going to be a very tricky one to look at, and because Greater Manchester's performance on the sort of headline NHS measures that we often talk about and look at has not been very good at all, especially on A&E. They've really struggled and lagged behind the national average and the Northwest average. But whenever I've kind of gone to them to talk about this, that they say, well, we are making very good progress on the kind of prevention side of things and the wider determinants of health. But it is difficult to measure those things. I mean, I'm kind of in the process of doing that at the moment.
They're very slow, these things are very slow, aren't they?
Yeah, and obviously they'll take quite a few years.
So Lawrence, do they intend to replace John Rouse?
Don't know yet.
Because that will be very interesting, whether they try and replace like for like, and whether they can attract. John was a big hitter, former Director General at the Department of Health for Social Care. It'll be very interesting to see whether they can attract. That would, I imagine, tell us a lot about what people believe potentially left in the Devo Manc model, depending on who steps forward to get that job.
And I think this is the big kind of. Sorry, Lawrence, you go ahead.
Well, I doubt they're going to get someone of that sort of stature, because a lot of the functions of the devolution team are now moving into the providers in the shape of the sort of provider board that's been set up and is now led by Mike Deegan of Manchester Foundation.
So Mike has he's played the long game and he's come out on top once again.
Surprise, surprise.
And I think that the leadership point I think is crucial. Thinking about what this means for the national agenda is leadership and having sort of solid, stable and credible leaders of integrated care systems and STPs has been a real difficulty for several years. And I think that's with people like John was one of the few who really was of that skill and stature and credibility, and also one of the few who had that, who wasn't sort of a co-opted retiring acute chief, whereas we got in South Yorkshire Andrew Cash, who's obviously clearly a senior and credible leader, but there's a number of areas that have only achieved that by taking people who are basically retiring and sort of gradually on their way out.
Maybe they'll offer it to David Dalton.
But I was going to say, but presumably not across the table from famous Manchester rival Mike Deegan. But there's a big question there about whether they can get people like that to keep doing these jobs.
There was an interesting joke actually told at David Dalton's leaving do that I went to, where he was talking about the long rivalry that him and Mike Deegan have had, and said that he'd called Mike Deegan up once. I think this was a joke really, but he said, so Mike, I've got a plan for us. I think we could share the mayoralty for Greater Manchester. How about I could be the daytime mayor and you could be Greater Manchester's nightmare?
Entirely in jest, no doubt. Anyway, we're coming towards the end of our time. So thank you, everybody, and final messages. Please share our podcast in whatever way you see fit. Come back next week. We'll be here again to download on Friday morning across all the relevant channels and on hsj.co.uk. Please visit hsj.co.uk. There's plenty more of this sort of thing there, and you can sign up to subscribe. Encourage your organisation to subscribe for more insight and analysis. And if you've got any feedback or things you'd like us to discuss, then get in touch on Twitter or email dave.west@wilmingtonhealthcare.com. Thank you. Bye.
Cheerio.